take a second and shift gears and talk about the future while you know, my gang up here has done a fabulous job. I just want to show you kind of what we're seeing in the very near term. You know, we're expecting our cost this year to be about $9,100 per employee per month or for the year. Towers Watson does a survey every year, and they look at high-performing companies and low-performing companies. The high-performing companies are ones that actively manage the cost of health care for their particular group. And as you can see, their estimate is a little bit higher than ours, but not much. But it's the low-performing companies. Those are the ones that say, okay, well, it's time to renew the health plan, and so what do we do? You know. And the point that I want to make here is that in order to keep the costs that we've all agreed are going to be significant as we go forward, you're going to have to get into the very active management of your health plan. This is another interesting slide which shows the shift over the last 3 years, 2.5 years. What I want to show you is the bottom line, which is the green set of numbers. That's our enrollment of worksite employees at all of our 5,800 clients and 100,000 plus worksite employees. You can see that the migration to the high deductible health plans has absolutely started to skyrocket, and we expect to see a huge continuation of that. It's called cost shifting. Employers are not going to pay the freight. You and I as individuals are going to pay the freight in some form or fashion from this new health care bill, and it's already happening in the marketplace, and we're seeing it, you know, every single day. The old traditional HMOs are just about dead, and the regular PPO programs are still pretty strong, but it's the higher deductible PPOs are the ones that people are enrolling in. I'm not going to really go through a lot of items here. What I did is try to carve this thing up, this new bill, in terms of when it comes into effect and what relates specifically to employers. So we've talked about the stuff that comes into play immediately. We're talking about the tax credit for employers that purchase the health insurance for their employees, and there's some levels there. There are some of the pre-existing conditions, and those are going to be some items that are going to drive the cost significantly over time. There's already a requirement for W-2 reporting of the aggregate health care value of the benefits that are paid. That'll be a new item in 2011 for the 2010 plan year. And then, of course, some elimination of employer tax deduction for those of you that have retiree drug subsidies in your plan. We move on to 2013, and that'll be the 3.25% or 2.35% going 1.45 to 2.35% for Medicare when your income exceeds $200,000 a year. There's also a provision in there that's an unearned credit. That's not an employer deal, but if you have unearned income over that, you're going to be taxed on your unearned income as well. So it's just some more stuff. The additional tax that will take place. 2014, the gang already told you about, you know, that's the pay or play year, and the world will change dramatically at that point based on whether or not how much of this stays as law, and that's still, I guess, a little up for debate, but we've got to plan as if it's that way. The bottom line here is that the cost of health care is going to go up dramatically. There is no way it will not. And that chart of a 5.64% compound annual growth rate that I brought up to show you, you know, we come back in 5 years, it'll be interesting to see what it is, but I can say this: past performance is no guarantee of future results, unfortunately, in this case.